Hi friends, I am Dr. Neelakandan from Lister Hospital, Chidambaram. Let me now discuss about the clinical signs, symptoms and findings and problems with the thyrotoxicosis. Number one is a scleral show. Normally, in normal persons, we do not see the whiteness of the eye in the upper half whenever we turn this way or that way. In thyrotoxicosis, that is widened palpable fissure. So the upper half of the sclera will be seen. That I'll show in a patient now. Next one is a lid lag. The upper eyelid doesn't move as promptly or as smartly when you ask the patient to look up and downwards. Whenever if you do the patient to look up, down, the eyelid will follow the eyeballs, and there will be lag of movement in one or both the eyelids. This and there will be lid retraction also. This we call it as a Van Graaf sign. Then ask the patient to look upwards, and you see the wrinkling of the forehead, which will be absent in thyrotoxicosis, Mobius sign. Then the fourth important sign which you see in thyrotoxicosis is proptosis. That is a bulge of the eyeball outside the orbital cavity. This can, in extreme cases, this can produce double vision. They call it as esotropia. Then the fourth important symptoms with which the patients will come with is dry eyes. The fifth one will be pain during eyeball movement. In extreme cases, the sixth point in eye issue in thyrotoxicosis is edema of the conjunctiva and ecchymosis of the conjunctiva, congestion of the sclera and conjunctiva. And extreme form of ophthalmic involvement in thyrotoxicosis is optic neuropathy. This is actually a bilateral thyroid swelling. The right half is more involved compared to the left half. Now, when you ask the patient to see left to right, you see the upper half of the white of the eye, that is the sclera, which is you will not see in normal persons. There is an important sign, lid lag sign. I am asking the patient to look at my finger upwards and downwards. Look at the eyelids. There is a lag in movement of the eyelids. This is called a Van Graaf sign. 1, 2, 3. Say when I am asking the patient to look at my finger upwards, in upwards gaze there will be wrinkling of the forehead, which will be absent in thyrotoxicosis. There is a mild proptosis in this patient. It is not a florid proptosis because she has been taking antithyroid drugs for long. I would say this is a mild form of ocular involvement in thyrotoxicosis. And she being on neomercosal for a long time, the ophthalmic complications are less.